Unfortunately, people with intellectual disabilities often don't receive proper care from health professionals and their staff. Providers often lack the training and expertise or are too busy to take the time to interact efficiently with those patients. The following reflects a care scenario that has been all too common.
Good morning. I'm here for our 9:30 appointment.
We're running late. You can sign in. Is this appointment for you or for her?
My daughter, Mary.
Fill out these forms and bring them back when you're done. Why don't you have a seat over there?
If these are medical history forms, I filled them out many times for Mary. Didn't her referring doctor send over her record?
Possibly, but I haven't seen them. You need to fill out our form anyway. Does she have insurance coverage?
Medicaid.
Can you speak louder?
Medicaid.
Who's her regular doctor and who's her dentist?
She doesn't have one. We don't usually go to the doctor unless it's something very serious. And it's even harder to find a dentist.
You didn't fill in the information about her last OBGYN exam or whether she's taking birth control medication.
Well, she's never had one of those exams. She doesn't have any need for birth control pills.
Very small. Are you married?
No, my daughter is Mary.
Oh, then you better come in too so the doctor has someone to speak with. Follow me.
Okay, so let me help you.
So, what are we looking at today?
Well, I was told that Mary has high blood pressure and that she's a little bit overweight. I am concerned that it just seems to be getting worse, especially after she left school. She never does anything but sit at home and watch TV. Maybe she'll take a nap, then she'll get up and watch more TV.
Well, these people don't do well following healthy lifestyle habits. So we'd seem to have a caloric intake expenditure imbalance. How much television does she watch?
Oh, about 10 hours a day.
Is she eating snacks while she's watching TV?
Well, I work all day, so yes, I leave her out some cookies and chips and cereal, and they seem to be gone when I get home.
Well, let's have the nurse check her blood pressure.
Put your arm down.
Not so bad, 190 over 50.
Well, I just try to cut out the sweet stuff. That'll keep her weight down. She looks to be about 20 pounds overweight. Please take off her shirt so I can listen to her heart.
Well, how about her blood pressure? Doesn't she need some medicine?
Let's just cut out the sweet stuff.
The lady out front asked me about Mary, if Mary ever had an OB-GYN physical.
Well, I wouldn't worry about that unless she has a problem. Does she have a problem?
No.
Well, I see you've got a Special Olympics form. I suppose you want me to fill that out. Well, drop them off at the counter in the waiting room.
My head hurts.
Doctor, you're running late. Your next patient's waiting.
You should probably make her a dental appointment.
Let's go, Mary.
With some simple adjustments in style, communication, and caring, the relationship between health care providers, staff, and patients with intellectual disability can be more beneficial and rewarding to patients and providers.
Good morning. I'm here with Mary for our 9:30 appointment.
Hi, Mrs. Small. My name's Gloria. It's nice to meet you.
Nice to meet you too.
You must be Mary. It's nice to meet you. Why don't you both have a seat? The doctor will see you shortly. In the meantime, could you fill out these forms for us? And I'll need a copy of your insurance card.
I have that right here.
Okay, the doctor should see you soon. She's very nice. I think you'll like her.
Terrific. Thank you.
Oh, hi, Mrs. Small. I'm Dr. Murray.
Hi,
Nice
Dr.
to
Murray.
meet you.
Nice to meet you too.
You must be Mary. I'm Dr. Murray. I hope you haven't been waiting too long. Why don't you follow me and join my nurse in the one of the exam rooms? Hi, Mary. This is Susan, my nurse.
Hi,
Susan,
Mary.
say hello to
It's nice to meet you.
Mrs. Small.
Mrs. Small,
Hi,
nice to
Susan.
meet
Nice
you.
to meet you too.
Mary's going to jump on the scale and check her height and weight.
Right over here, Mary. We'll get your weight. Okay, that's good. Would you like to get up on the table? Come on over. Just a moment. Let me help you get something to help. There we go. Have a seat and the doctor will examine you.
Hi, Mary. I bother you? Yeah. Okay, I'm going to adjust it. Is that better?
Yeah.
All right. Would it be all right if I took your blood pressure? You
Yeah.
ever seen a cuff like this before? Yeah? Very good. You're good at that. Yes. Thanks for helping me. And you know what this is? I'm going to listen. There we go. Need to see that. That's not too bad. You did good.
Wait, oh.
Well, your mother's been telling me that you feel tired in the afternoon and you don't feel like eating. Is that right?
Right.
You want to lay down all the time? Mm-hmm. Well, we'll need to find out how to help you get some of your energy back so you can enjoy some of those activities after work. I have to ask you some questions. Is that okay?
Yeah.
And I want you to know that if you want to ask me anything, you can, okay?
Okay.
All right. Mary, are you sleeping okay?
No.
No. What time do you go to sleep?
What time do you go to sleep, honey?
8
And what time do you get up?
and 6 cups.
6. And do you know if you sleep the whole night? All night long? No. No?
Well, she gets up to go to, you get up to go to the bathroom, honey. You also complained the other night that your tooth hurt.
My teeth hurt.
Your tooth hurts. Well, do you think she gets up several times?
Yes, she gets up
Yes.
several times a night.
Okay, well, that's good for me to know. You did good, Mary.
Thank you, Dr. Mary.
Do you have to go to the restroom a lot at work? Do you go to the bathroom a lot at work?
Yeah.
Yeah, just at work?
Not the one.
Yeah. Well, we're going to have to look to see if there's any germs that might be causing that. And if there is, we're going to give you something to help you, okay?
Okay.
All right. Mary, can I take a quick look at your mouth?
Yeah, I think I need that one.
It's okay. You can just sit up. How about that? All right. Good job. Well, I think I see one thing that might explain part of that problem, Mary. I think you've got an infection in your tooth right back here, and I think it needs to be treated. I want to call my friend, Dr. Wilson. He's very good, and he likes to care for people, and he's very close by, Mrs. Small.
Tommy, I did it yesterday with Tommy.
I know you did. Well, Mary, I think something else has to happen here. I think you need some exercise. I think you need to move around and maybe play some sports. What do you like to do?
Listen to music.
Well, that's fine, Mary, so do I, but just listening to the music with your ears won't help you move around and get any exercise. Maybe we have to do something else, like dance?
I can't dance.
You can't? Well, I can't either. My husband thinks I dance like
Quack,
a duck.
quack.
Mary, remember you like to go bowling with your cousin Michael.
Yeah.
What did you do when you went bowling?
Like an and
The lights came on? That sounds like it was a lot of fun. You know what I think? I think you'd like to become a Special Olympics bowler and maybe see if you could win a medal.
Yeah. May I come out?
I'm sure you can, Mary. You can do anything you want.
Make a documentary.
I'm going to write you a note that says that you should try Special Olympics. It's especially for you. My nurse will give you and your mom some information on eating good food and snacks, and she'll give you the phone number for Special Olympics. In no time at all, you're going to have more energy and make some new friends.
Thank you, Doctor.
You're welcome, Mary.
Thank you, Dr. Murray. We've never had a visit quite like this one. I really appreciate it.
Well, goodbye, Mary. It was very nice to meet you. Don't forget, you need to see Dr. Wilson about that tooth that hurts, okay? See you later.
Thank you.